My name is Batul Kaj-Carbaidwala. I am one of I'm a pediatric hepatologist and GI doctor at Loring Children's. Um, I first became interested in telomere disorders after having the absolute honor and privilege of working with your very own Dr. Cass Myers and one of our friends in common, Dr. Michelle Wang. And it really came about, this sort of interest really developed from patients. We met a couple of patients who had telomere biology disorders and liver disease, and we realized that we don't know enough about this and that we really need to understand this disorder better and how to really help to treat patients. So what I want to do today is just sort of talk you through what little we know about liver disease and telomere biology disorders, kind of what you need to know as a patient and as a family, and how you might be able to sort of look out for signs and symptoms of liver disease, and how you might be able to sort of advocate for yourself when it comes to, when you're perhaps working with a team who doesn't know very well what happens in the liver with TBDs. So I'll kind of walk you through some of what we know. And I'm sorry I'm not there with you all in person. I hope everyone's having a wonderful time at camp. And I very much hope to be able to attend at some point. But yeah, just know that I definitely am feeling the FOMO and feeling that as if I'm missing out. So what does the liver do to begin with, right? So it's my favorite organ. I hope it's yours too. It will be after this, I think. It does a lot of things. It has to do, so, some of the biggest things that we think about with the liver is that it processes blood that comes back from the organs of the body, and it sort of detoxes it, right? So it clears out a lot of all of the bad juices from the blood. It has a lot of really important synthesis tasks, which means making things in the body. So proteins and a lot of the things that we need for a kind of metabolic processes get made in the liver. It's really important for metabolism of different medications and drugs. It's really important for blood sugar control in our bodies. It basically does everything. It's like one of the best organs ever. When things don't go so well, there's a lot of potential functions and issues that don't happen as well when the liver is irritated or unhealthy. So what actually happens to the liver in TBDs? Well, the truth is we're not entirely sure. We have some theories and some kind of sense of what we're dealing with, but it's very common. It happens in about 40% of patients with known telomere biology disorders. The theory is that the liver typically deals with a lot of stress, inflammation, kind of as we go through life. It has kind of a good way to be able to regenerate itself. The thought is that when you have telomere biology disorders, your cells don't regenerate as well. And so the sort of normal stress and inflammation that you were expected to deal with in your normal lifespan, unfortunately, isn't able to happen in the same way. So the liver in telomere biology disorders can get irritated, it can get inflamed, which usually presents as elevated liver enzymes on blood testing. You could have jaundice or an enlarged liver. You could have sort of the later complication of cirrhosis, which we're going to talk about in some detail, which comes then with portal hypertension, which is a complication of cirrhosis. And I'm going to explain those terms in a little bit more. And I think one really important takeaway is that hepatopulmonary syndrome is something that patients with cirrhosis get, but it seems to be, and we're still learning more, as I said, but it seems to be that hepatopulmonary syndrome is more of an issue for patients that have telomere biology disorders than in kind of other patients. And so that's something that we have to sort of think about more. So as far as elevated liver enzyme and jaundice, well, most of the time you don't have any symptoms other than maybe you might develop yellow skin or yellow eyes. You might get your blood tested when those things happen, and we might have elevated. These numbers that I've listed here are the ALT, AST, GGT, and bilirubin. Those are specific tests that we send when we're thinking about the liver, and they might be high in patients with telomere biology disorders. In those situations, what we really must do and what you really must advocate for yourselves is to have the doctors make sure there's nothing else going on, right? So if this is something that's a new finding for you, or even if it isn't, you should always be evaluated for other causes of liver disease. So infections, autoimmune conditions, other types of chronic inflammatory disorder. and make sure someone runs through any medications that you might be on and check to make sure that none of them have liver damage possibilities as a side effect. So really make sure that when someone tells you, hey, your liver enzymes are abnormal or your bilirubin is abnormal, and they tell you, we think it's because of the female disorder, they might be right, but it's important for them to check for those other things too. In general, I think the recommendation at the moment from our perspective is if you have a known telomere biology disorder, someone should be checking your liver blood test, so your enzymes and your bilirubin, I would say at least every 6 to 12 months, and then probably more frequently if they've ever been abnormal. So that's something, again, that you can kind of make sure to have on your checklist of things to do is have someone check those blood tests every 6 to 12 months. So cirrhosis. What is cirrhosis, right? Well, if you see the picture on the left, it is, where it says normal liver, that is essentially, a nice, shiny, beautiful, pinky brown color with kind of a nice smooth edge to it. That's what a normal liver looks like. Livers that are cirrhotic, which is another way to say scarred or or fibrotic, those are other words you might hear used. That's a liver that has a lot of scar tissue in it, not a lot of healthy tissue left, has this kind of bumpy, darker appearance. And it's hard to tell in this picture, but usually cirrhotic livers are a little bit smaller as well. And so you can just imagine by looking at these pictures that liver on the right, the cirrhotic liver is just really not working as well as the nice shiny one on the left. Patients, for you all and kind of your family, thinking about when do I need to worry about this, or when do I need to be evaluated for this? Well, again, the symptoms can be somewhat non-specific, right? So a lot of these symptoms in early cirrhosis or early liver disease might be things that you and I have all the time, right? So unfortunately, I don't have a poor appetite. My appetite's a little too big, but low energy for sure. Maybe you have a poor appetite. Maybe you're having some weight loss. Maybe I'm just not feeling quite yourself as far as your mood. And itching, actually. Itching can be kind of a more specific thing when it comes to the liver. So if you feel like you're having those things, you really don't have a good explanation for those things, really go get your blood tested. That's one of the ways that you can spot this obvious. Some of the later signs of cirrhosis, so when we start to have complications related to the cirrhosis, and some of that was shown in the video here, are things like abdominal distension, which is where your belly just seems to be getting bigger and bigger. You can't explain why. GI bleeding, any type of GI bleeding episodes need to be evaluated. And if there's any change in sort of behavior or some type of confusion, so you may feel that yourself, or feel the patient, or if the patient is kind of a younger child and you're thinking, I don't know, this kid's just not acting the same, seems a little bit different to how they used to be, that may be an indication to start thinking about the liver health. So those are just some things to kind of bear in mind and kind of look out for, and definitely seek medical attention if you're feeling any of these signs of symptoms. I won't spend too much time on this slide. I sort of included it for reference, but there are a lot of different features that you could see on someone's physical appearance or their body or the exam that relate to chronic liver disease. So if you're starting to develop or have already developed chronic liver disease like cirrhosis that we think ultimately is related to the underlying telomere biology disorder, then you might have some of these features. So this starting from the top, there can be some skin changes. There can be kind of little visible blood vessels on the skin surface. The belly can start to be enlarged, as we talked about. Someone might tell you, hey, your liver is starting to feel big, that bigger than it used to be. Maybe you start to have kind of red rash on your palms. And your fingertips may change. Now, I will tell you that all of this, it doesn't have to happen in every patient, right? So this poor guy over here in this picture is unfortunately suffering with all of the complications and all of the signs, but that's not what happens in real life. And so I think that really the main thing is to have a look at this list and think to yourself, is anything about this that maybe seems familiar or hasn't been evaluated? Then definitely something to think about. I will also say that we know that telomere biology disorders, particularly in dyskeratosis, you can have some of these issues already. So, especially the finger clubbing, which is that kind of change in the appearance of the fingertips, can actually be associated with some disorders of bone marrow. So just kind of bear some of that in mind. So I talked at the beginning about hepatopulmonary syndrome and how that is something that we think is particularly important for patients with this fibrosis congenital and other telomeral disorders. Hepatopulmonary syndrome is difficult, I think, in this particular patient population because of the fact that there may be many of you in the audience that already have some lung involvement as part of your disease, right? That you may have some shortness of breath issues or some changes with kind of your lungs. And what's challenging about that is that this is also some of the same symptoms that you might experience from the lung disease that you already may have from your tumor biology disorder can also be related to hepatopulmonary syndrome, which is a really interesting, I think, and somewhat stressful condition that links kind of the liver and the lungs. And what we think happens is that when the liver is having cirrhosis or is scarred down, it sort of changes the way that there are certain chemicals that then float around in the bloodstream and go into the lungs and cause sort of changes in how the blood vessels contract and dilate. That's a long story to say. You end up with these pulmonary arteriovenous malformations. And that just means that blood that isn't completely oxygenated can sort of scooch over into the venous side, and the blood kind of gets mixed up, and it means that your blood isn't delivering really nice kind of oxygenated blood kind of to different areas of your body. That can present in some of these ways that are listed here. So dyspnea is just a way to say difficulties with breathing, right? Tachypnea is an orthobiopsy. I'll explain a little bit because those are specific symptoms. So tachypnea basically means your shortness of breath or your feeling of not being able to breathe well actually is worse when you're upright than when you're laying down. So that's something easy that you can just check at home, right? Like if you're someone who maybe already has some respiratory symptoms and some difficulties breathing, check to see which is worse. Is it when you're sitting up or when you're laying down? Orthobiopsia is a similar thing, but is actually related to the blood oxygen kind of concentration. So tachypnea is talking about symptoms. Orthobiopsia is the same movement, but actually someone then should measure your blood oxygen levels, and that can be done either with a pulse oximeter, which is a little thing that kind of goes over your fingertip, or sometimes with actual blood tests. There's something we have to do an actual blood test to check that. And so those are, again, it can be difficult, right? So like if you go to your physician, you go to your doctor and you say, hey, I'm having a shortness of breath. See, this is something that you should absolutely, if you have to say these words to someone to kind of trigger their thinking, say the words to someone, because hepatopulmonary syndrome, is something that, can help us then, can help guide all of the next steps in the management. So for example, if you have shortness of breath or no one's ever really talked about your liver before or ever really evaluated, definitely go and ask them to have that evaluation. Because sometimes it can be, the presentation can be the same, and then when we start to really investigate, we find that maybe there is a liver problem after all, and it can be helpful in then deciding, what are the options. Okay, so that's something that's really important. The reason why I sort of spent a little bit of time talking about this is because in some research that we are doing, and that I'll sort of present some of the findings later, is that it does seem that many of the patients who end up needing liver transplantation, or where someone is saying, hey, you need a transplant, it's because they might have developed this hepatopulmonary syndrome. And so it is something that's important. So what's the treatment, right? I guess that's kind of always the question. Well, let's talk that through. I'm going to make some really captain obvious statements. The general principles of healthy living also apply to healthy livers, right? So exercising as much as you can. Now, clearly that is something that is going to be difficult if you have lung disease or if you have other issues related to your underlying diagnosis. But as much as possible, exercise can be really helpful to really help kind of keep your metabolism going, keep your kind of muscle strength going, and all of those things are helpful for liver disease. So trying to really work out and figure out for yourself individually and kind of talking to people about what are some safe exercises that I can do to just keep myself active. That's going to be really helpful. A healthy, well-balanced diet. We should all be eating a healthy, well-balanced diet. I think it's particularly important for folks who have any type of liver disease, especially chronic liver disease and cirrhosis, because making sure you get enough protein, making sure you get enough fruits and veggies and all of the vitamins that come with that is helpful. And there are many dietitians now who can help kind of set up a plan for you. That would be something. This part, I think that middle section is, business generating for me as a liver doctor, but it's so important, right? Because making sure that you're seeing a doctor who has at least not just, maybe doesn't specialize in the liver and telomere biology disorders, but has some experience with cirrhosis and hepatopulmonary syndrome, and making sure that you are checked in with the liver team. And honestly, if that means asking your primary for a referral, and you have to do that yourself, do that, advocate. And that's really that next part, is advocating for yourself in these situations. I think patients and families who deal with telomere biology disorders, and with telomere, you all know better than anyone, I think, what patient advocacy means and how it can be helpful. And I, really am humbled by the work that Team Telomere does for all of you. And as a patient, it's really, truly remarkable what can be accomplished when patients stand together and say, hey, this is not okay, and we need better treatment plans. And I think we have a lot of work to do. So while we are figuring ourselves out for the medical side, you guys need to step up and you tell us when we're wrong, And I think that's super important, and something that has, in this very disease process, made a big difference. And when I say, with our help, I mean, Team Telomere is an awesome resource, right? Friends and family, your hematology team, and then really hepatology, right? So if you feel like, talk to your hepatologist, which is, by the way, a liver doctor, and say, hey, there are some people working on this. Is it possible that you might be able to reach out to them to talk more about my disease? I personally, I won't speak for most of my team, but I will tell you also that most of my team will be happy to help in these situations. So happy to sort of talk through cases and think through kind of what do we know, what don't we know, and we are really happy to help. So reach out if there's something, if you're coming up with roadblocks. What are some things that you might expect when, let's say, someone feels like, you've had some liver tests checked, when you've had some of these symptoms, and now you're kind of in the early phase, that sort of diagnostic. Well, as I mentioned before, one of the first steps is making sure you don't have any other liver disease, right? So that's often the first step. Thinking about hepatopulmonary syndrome, so doing some specific testing for that. That could either involve blood tests and usually an echocardiogram, which is an ultrasound of the heart that helps us to identify those pulmonary EVMs. And then staging, right? So really understanding, is this cirrhosis that is compensated, as was talked about in the video? Is it cirrhosis that is decompensated? Like what kind of urgency, right? And then the longer term follow-up is with the liver team, ideally, and with the liver team who is talking to, specialists in telomere biology disorders and who manage sclerosis, things like that. Really monitoring for the development of any decompensation. So as the video showed, things like GI bleeding, development of belly fluid, those types of issues. And then ultimately, talking about whether or not a liver transplant is something that can be considered for your individual case. So when do we really start thinking about liver transplant, right? So in general, no matter what disease you have, we think about it when you have decompensated cirrhosis, or if you have liver disease that is not going to get better and is now giving you kind of complications and that are potentially life-altering or life-threatening. If there are progressive difficulties with hepatopulmonary syndrome specifically, because we know that really the only cure for hepatopulmonary syndrome is a liver transplant. And what's really important, and I think what has historically been a bit of a barrier when we think about transplantation in patients with this sclerosis or with telomere biology disorders, is what are your other organs like? What are your other organs doing in terms of their overall health? So, for example, how's your bone marrow? How are your lungs? Is there anything about the rest of your kind of physical functioning and the rest of your health that means maybe that the liver transplant is too high risk for you, or that you or that you may get a liver transplant, but then these other issues might get worse. And part of the problem still, I will say, we're going to try our best to try to work on this, but we don't know the answers in most cases in terms of, what will happen 10 years from now if we do a transplant and, what will happen to your bone marrow, what will happen to your lung if you have kind of underlying cellular disorders. So there is, and again, you guys know better than we do, is that dealing with the uncertainty is so challenging because it's hard to say you can't do anything for what you're having now because of what may happen. But unfortunately, transplantation, it sort of does work like that sometimes. But we do have some promising results from some of the work that we're doing. So I will share that with you in a moment. But just to kind of make the point that liver transplant, I don't want you to come away from this talk and think, okay, if I get liver disease, I'm going to get a transplant, right? It's sadly not quite as straightforward as that. And I think there are lots of factors that get taken into consideration when any decision about transplant is happening. But what I really advocate for is that there should be a conversation, right? In every patient that sort of meets criteria for possibly needing a transplant, that no matter what their other diseases are, that there should be a discussion. There should be kind of lots of different specialists talking about what do we all think about kind of how this is. The first step is really you have to meet criteria to need a transplant in the first place, right? So you got to have some sort of liver disease or like cirrhosis, which is most of the time, or hepatopulmonary syndrome. And for you to say, I'd like to be referred to a transplant center to have kind of an evaluation. You get referral to a transplant center, and the transplant center will say, okay, come on down, we'll do an evaluation, which is the click again, so you can get your evaluation. Now, that's a really important time because the evaluation is where you get to meet a bunch of the doctors and different members of staff, nurses, social workers, psychologists, who would be involved in the process of the transplant and get to ask a lot of questions. And you will get a lot of information about what could happen, what are some of the things that we think about. Once you go through the evaluation process, then the team who is at that center, the transplant team, will sort of almost take a vote, right? Like the case gets presented and we almost sort of go around the table and say, what does everybody think about this, right? And if the majority of people say, yes, we should list the transplant, then that's what happens. You get listed on a waiting list for transplants. Now, there are different ways of doing transplants, and that's a little complicated and I think outside the scope of this talk, but I'm happy to, if anyone had specific questions about that, asking about that, I'm happy to try to address those, later, and I'll share my contact details with the teacher and the folks here. But there's a whole process that goes into kind of what happens when you're on the wait list, right? Then let's say you're on the wait list and you get an offer for a donor, which, typically is somebody died and their liver was healthy enough that they were able to donate that. So now you get offered a liver and, the team and you accept the liver. And then the next step is the transplant itself, which is a whole complicated set of surgeries that happen. Once you've had the transplant surgery, then the next two boxes really are what happens after the transplant, right? It's not over once you have your surgery. It's then exchanging, frankly, one chronic disease for another, because after a transplant, now you're looking at medications and monitoring and close follow-up and blood tests and all of the things that go into making sure that a patient who receives a transplant has the best outcome, involves suppressing the immune system, really monitoring for infections, monitoring for complications. And all of that happens, frankly, it's lifelong, right? So once we receive a transplant of any organ, the transplant team get pretty territorial and pretty needy with you, and will want you to come back for follow-up over and over again and get blood tests, and it's a whole thing. And we especially can tell you, in the kids, we hang on pretty tightly. To our transplant recipient children. So that is everything kind of I wanted to talk about today. Thank you so much for having me give this talk. I'm, again, having terrible FOMO for not being there with you, but really appreciate the chance to chat with you virtually in this way. I think Dr. Myers is going to take some questions live, and she is pretty much a hepatologist at this point. And if there's any other questions, please reach out to the camp staff, the Team Telomere staff, and have them send me the questions, and I will be glad to respond after the fact. I wish everyone an awesome time at camp, and hope that we cross paths physically in person at some point in the next. Thank you very much for your time.